And so in terms of levodopa, let's just talk about levodopa side effects. I think that, let me first just talk about what levodopa is. So as soon as we learned that there was a deficiency of dopamine, we started playing around with how do we boost dopamine, right? Dopamine is a naturally occurring molecule. It is made from an amino acid called tyrosine. And so, we started giving tyrosine, and we could get a little teeny boost in dopamine production, maybe a little teeny improvement in symptoms. And then we moved it from tyrosine to L-Dopa, and we realized you can actually do a really good job. If you give the dopamine precursor L-Dopa, your body can make more dopamine as it needs to. You kind of set the stage. It's like putting all the ingredients in the bread maker and getting bread out the other side. By giving L-Dopa, you give the body what it needs, and it can make its own dopamine as it needs to. So we started realizing that this was a really good strategy for treating, for augmenting the body's inadequate production of dopamine. The problem is you had to take a lot of it. To get enough L-Dopa into the brain to treat your Parkinson's symptoms, you have to take really high doses. And so such high doses that it would often cause nausea. And so what would happen is people would take these high doses of L-Dopa, they'd get sick, they'd be very nauseous, often throwing up. But then once it was into their system, they could actually move really quite well. The tremor would go away, the movements became more fluid. And so what happened was, it was a huge advance in pharmacology when we realized that when you add just a little teeny bit of another molecule called Carbidopa to the levodopa, that you could reduce the levodopa dose by, I think it's something like 90%. You can use about 1/10 as much. I'm not really exactly sure about those numbers, but it was a huge reduction in the amount of levodopa you needed as long as you partner it with Carbidopa. Kind of from a pharmacology perspective, what it is kind of think of the Carbidopa as keeping the levodopa protected. And so it gets into your stomach and into your bloodstream, and it's nicely wrapped up in this little Carbidopa package. And then when it gets to the blood-brain barrier, what will happen is the levodopa can slip across and get into the brain, but the Carbidopa is stuck on the outside. And so what this allows you to do is take a lot less levodopa, and you don't get the nausea, the side effects that you used to get, because it's kind of, the body's not really getting it. It stays wrapped up in the Carbidopa until it gets to the blood-brain barrier. The levodopa slips across. It can replace the brain's dopamine, and you are able to take a much lower dose than of the levodopa because of the addition of Carbidopa. So that was a huge advance. The word Sinemet is Latin for without vomit, and so Sinemet is actually the brand name for the combination drug Carbidopa and levodopa. So a lot of times when people are on their medication, the shorthand is Carbidopa levodopa C/L is what we talk about it. And when we refer to it, we really just call it levodopa because that's the medicine part. That's the part that's treating you. And so it'll often be 25 milligrams of Carbidopa per 100 milligrams of levodopa. And there are different drugs and different ratios, 10 100s, 25 100s, 50 200s. But what those numbers refer to is the dose of Carbidopa and the dose of levodopa together in one pill package. And they really do go together nicely. Levodopa and Carbidopa are both naturally occurring molecules. Fava beans have both levodopa and Carbidopa in them. There are other sources of levodopa. The plant Mucuna has a lot of levodopa. It's a very rich source of levodopa. And many patients who can't take Sinemet, the pharmaceutical preparation of Carbidopa levodopa, for one reason or another, or don't want to, are often able to take a dose of Mucuna and get quite a bit of benefit from just taking the L-Dopa that comes naturally in the Mucuna plant. Fava beans have both Carbidopa and levodopa. The highest concentration of carbidopa and levodopa tends to be in the sprouts that are 7 or 8 days old. So I suppose theoretically, if you wanted to start sprouting your own fava beans and juicing the 7 or 8 day old sprouts to get your own, natural or herbal concoction of kind of fava bean cinnamon, you could theoretically do that, but it doesn't make sense. It would be ridiculously time intensive, and it's not very well standardized. But I do think it does make some people more comfortable to know that both carbidopa and levodopa occur naturally. So in terms of carbidopa, levodopa side effects, the carbidopa did wonders to cut the nausea. But some people, especially that first month when you start levodopa, tend to get nauseous. The nausea is probably the most common side effect from starting levodopa. If you start slowly, we tend to start you with little doses, increase it over the first week just to get your body used to it, and go and introduce the medicine slowly. That helps the nausea a lot. If you take your levodopa, when I say levodopa, I am referring to that combination, carbidopa, levodopa. If you were to take it with a little bit of food on your stomach, take it with a banana, take it with an apple, some applesauce, a bowl of oatmeal, just a little bit of something on your stomach is often very, very effective at cutting the nausea. I've had very few people, 2 people that come to mind who had really bad nausea the first month. Even though we introduced it very slowly, they had a really hard time with the nausea. One person took a prescription Zofran for a month. Another person used cannabis for the first month to quiet the nausea. And as soon as their body was used to it after the first month, both of them were able to stop the anti-nausea medications, cannabis or Zofran, and just take Cinnamate, levodopa without. And so it really just is a matter of getting your body used to it. And most people do not tend to have a huge problem with nausea over time. It's just while your body's getting used to it. For a small group of people, levodopa can make constipation a little bit worse. For some people, it can make blood pressure lower your blood pressure a little bit more. So sometimes if you're not expecting it, you start meds or you raise your dose of levodopa substantially. I've had a couple people develop syncope. They get dizzy, pass out essentially, faint, and so that can be really scary. And so it's not a common reaction, but it's one that I like people to know about before they start a med or before they change their dose. Just hey, if you find yourself you just started levodopa or you just increased your dose, and now when you stand up you get dizzy. It's not the Parkinson's, it just happens to be a medication side effect. And I should say too that even people who aren't on any medications get low blood pressure with Parkinson's disease. We'll talk about low blood pressure in a whole separate video where we talk about non-motor symptoms. But I just want to let you know that levodopa can make a couple of these symptoms worse. The side effect that scares most people are the dyskinesia. They're called levodopa-induced dyskinesia. And it's a writhing motion. It's like a wiggling motion. And for those of you for people who don't have Parkinson's disease, it's too much dopamine. It's not that different from, the kids at the club who take ecstasy and it just feels good to move. I mean, it's almost like that. Every day in clinic, I see people who are scared to death of dyskinesia. The number one reason people do not want to start levodopa is because they are afraid of dyskinesia. When you see somebody with dyskinesia, it's very distracting. It's hard to divert your attention away. It looks bad from the outside because you're writhing and wiggling. Tremors are easy to ignore. You can see someone that has a little tremor and just to turn your attention away, divert your attention, and you've forgotten about it. If you're sitting across from the table from somebody who's writhing and wiggling, they're not predictable rhythmic motions. They tend to be writhing motions. It's a little harder to ignore. And so because of that, there's this fear that these dyskinesia are horrible and I don't want dyskinesia, so I'm not going to start levodopa. The fear of dyskinesia is so disproportionate to the number of people who actually get it. and the people who complain about it. For a person who has dyskinesia, first of all, I will talk to you about how to prevent it later. It is very uncommon for people to come in and actually need help with dyskinesia. Part of that is because, at least in Seattle where I live, all of the physicians are very, very good prescribers. We've just gotten really, really good at prescribing. We recommend a lot of exercise. People take care of themselves. We as a community have fewer people suffering dyskinesia today than we had 10 years ago, because prescribing practices are changing, new medications are coming on board. And so we see less of it, but more often than not, what happens is people do have these little teeny dyskinesia. I can see somebody who while we're sitting there, their wrist is moving around a little bit, and I say, what percentage of the day do you have dyskinesia? The most common response I get is, I don't get dyskinesia. What dyskinesia? And I say, oh, don't you see your wrist moving around a little bit like that? Oh, is that what that is? Oh. Most people don't even notice they have it. Someone's partner is much more likely to notice it. Oh yeah, while she's doing dishes, her foot is doing this little teeny dance. It is not something that a lot of patients complain about or notice, and that's not all the time. I mean, there are certainly exceptions to this rule, but more often than not, it is myself bringing attention to it, a partner bringing attention to it, and then we can kind of mess around with doses and make some changes. So I will tell you, for patients who have not been under the care of a really good prescriber, or maybe they're 30, 40 years into this disease. I mean, I have a patient who was diagnosed when she was 8 years old. I have patients who are taking 30, 35 tabs of Levodopa a day because they've had this disease for 30, 40 years. So there are some cases where it is hard because of the duration and the number of pills that somebody's on, but it's a fairly easy thing to treat. So let me just stop teasing you and talk about how I treat it.